Well, thanks, Steve. And that's one of the advantages of having done this as long as I have. And I actually started in public health in Washington State in 1987. And so a lot of this history of the system that I'm going to be briefly touching on, I've actually experienced personally. So the main thing I'm going to talk about today is local boards of health and the opportunities that are there for tribal membership and representation. But I thought it'd be useful to kind of cast that in a larger context and just to try to explain, at least from my perspective, what the public health system currently looks like in Washington State. Because if you're going to be on a local board of health, you become part of that system. So it's good to know what that system is. Here's the brief history of it. And as I said, most of it, or at least much of it, I shouldn't say most of it, but much of it I've actually lived through. Public health, the notion of local health officers and often working for city councils, it goes back to colonial times. It's ancient. And here in Washington State, there were health officers in Seattle was in 1877. I know there was one in the late 1890s in Port Townsend. And that used to be the public health system. Basically, a local group of politicians would hire a local doctor to do what public health things could be done at that time, quarantine and condemning food supplies and trying to assure clean drinking water, things like that. The notion of an organized system started with statehood in 1889, when the State Board of Health was actually established under the state constitution. And they've been meeting consistently ever since then. And then it wasn't until 1911 you started seeing county level boards of health. The first one was in Yakima. It was actually one of the first in the United States. And it was formed to help deal with the cholera epidemic in Yakima at the time. And then to many people, this next one might be surprising, that the Washington State Department of Health did not come into its current form until 1989. Prior to that, it was part of the DSHS, the big Health and Human Services Agency. So it only started developing as a separate entity in the last 30 years or so. And then things really kicked into gear in 1994, when, as part of health reform in the state, a document known as the Public Health Improvement Plan was created. And that defined the public health system as having 4 distinct parts, including what was called a tribal health jurisdiction. And that plan was enacted into law the next year. And it's been evolving ever since then. And the latest evolution was in 2012, when this legislation that set up these what are known as foundational public health services was enacted. And the idea of this is to assure that a basic minimum level of public health services are available throughout the state. And then finally, we'll be talking more about the most recent legislation, which was House Bill 1152, which changed the composition of local boards of health and actually created a state public health advisory board, both of which have mandatory tribal representation. So this is kind of a picture of what the current system is supposed to look like, with these 4 components, none of whom are subservient to the other. Each have individual authorities with a lot of interaction among the different parts of the system. That is most incompletely defined is actually in the area of tribal public health services. A lot of the legal authority for what's been going on in the state that came from the Centennial Accord in 1989, which established government-to-government relationships between the tribes and state agencies, and created a requirement that they consult and work closely with the tribes. And then the Public Health Improvement Plan, as I mentioned, took that a step further. And during that era, I was just, as I was preparing this, I was remembering a project we had at Jamestown where we were asked to survey all the tribes in the state and see what kind of public health services they were doing. And we got responses from all of the tribes at the time. And it turned out they were already doing a lot of things that would be considered core public health services. Since that time, this notion of a tribal health jurisdiction has been steadily evolving, and it's really unique in a lot of respects. It has some similarities to the state health jurisdictions in that you have a sovereign governmental authority, you have a direct relationship with the federal government, but it also has some things in common with local health jurisdictions in that there are geographic boundaries, there's a defined population that's served, and there's state and tribal direct relationships. But it's very much a work in progress, and in practical terms, what public health services are for each tribe has a lot to do with what the needs of that tribe are, what the capacity to provide those services is, and what kind of funding is available to sustain them. So this is moving along. This is what foundational public health services is supposed to look like in one picture. And I won't go into the details of this, but in the outer ring, there are these 6 kind of basic functions of public health that have to do with things like epidemiology and emergency preparedness and community partnership development. So all these things that kind of sustain the model. And then they generate these set of another 6 categories, that the things we often associate with public health. So communicable disease control and chronic disease prevention and environmental health protection. And this is what Washington State is currently trying to develop, is a comprehensive system where all of these services are available everywhere in the state. So the latest effort at health reform in this state is what was known as Engrossed Second Substitute House Bill 1152. And this was a bill that started off very ambitious. It attempted to fundamentally remake the public health system in the state, get rid of local health departments, turn them into regional health districts, have health officers employed by the state. And most of those things did not come to pass in the bill. It ended up getting scaled down considerably. But what did get passed is a couple key things. One is it established this statewide public health advisory board to try to oversee reform of the system. And then it established requirements for local boards of health that they expand their membership to include a wide range of non-elected officials, including tribal representatives. And this is something that the State Board of Health is working on now. The State Board was tasked with writing rules to further specify how these different non-elected persons would be selected and represented on the local boards of health. It also, there are some grandfather clauses in this law too. So there are some local boards of health that if they have public health advisory committees, are not required to change their composition. And I neglected to test or to check which boards fall under this. Just off the top of my head, I'm thinking that maybe Snohomish is one of these boards, but there may actually be others.
Hey, Tom,
Yeah.
let me throw something in because this is pertinent. They also have a period of time, I think until June or July of this year, that they can stand up an advisory committee, and then they don't have to expand their Board of Health.
Yeah, and I'd have to what I saw in the State Board of Health's presentation is that those bylaws had to be enacted by January 1st, 2021, which is interesting because that of course is already passed. That could have been a typo, but that I took this language right off the State Board of Health thing, so we could further check that out. What the bill does say is the two things that are on this slide is that, you know, basically if you share boundaries with a federally recognized tribe or a 501c3 that provides services for a tribe within your county, then you're required to have a tribal representative selected by the commission on your local board of health. And then also this state advisory board is required to have two representatives from tribal governmental public health sectors, also selected by the commission. Which brings us to what exactly does the local board of health do? And this is something as a local health officer, I dealt with a lot because basically a local health officer works for a local board of health. And so I did this for 27 years for Clallam County and 25 years for Jefferson County. And during that time, had the opportunity to orient a lot of new local board of health members. And usually the way I would start would be to show them the law, to show them this section in the revised code of Washington about the powers and duties of a local board of health, and highlight the first sentence in that statute that says a local board of health shall have supervision over all matters pertaining to the preservation of life and health of the people within its jurisdiction. And then I challenged them to, if they could come up with anything related to health that doesn't fall under that category. That definition is that broad. And then it goes on, the statute gives some more specific kind of duties. So local boards of health and local health officers are responsible for enforcing the rules of the State Board of Health and the rules of the Department of Health. And there are a lot of them, and they're very detailed about food safety and a lot of different environmental health codes and communicable disease controls codes. Also has general duties over sanitary measures. A local board of health can enact its own local rules and regulations in addition to those of the State Board of Health, as long as those rules are more stringent than what the State Board of Health is doing. A local board of health cannot adopt a rule that's less stringent than the state rule. And then a board has responsibilities, very broad responsibilities for controlling dangerous, contagious, and infectious diseases, to abate nuisances, which is a whole nother area of law, and then to make reports to the State Board of Health. And finally, and importantly, a local board of health can assess fees to support the costs of doing all this enforcement activity, which they do. They adopt fees for mostly environmental health services. So that local boards of health, at least in statute, have very broad authorities, authorities that are in many ways comparable to county commissioners, although focused specifically on the realm of health-related activities. And this is my first slide, and it's just highlighting what are the opportunities now for increased tribal involvement in the public health system, and in doing so, this ongoing development of tribal public health capacity. One of the opportunities is to shape the next phase of public health system development at a state and federal level. And I predict this is going to be, the stakes have grown much higher in this respect as a result of the pandemic. You know, as a result of the pandemic, we've realized that, you know, we should have been better prepared. We should have had a better system developed. We actually had a better system in about 15 years ago, and we dismantled a lot of it. So you're going to see a lot of sort of soul searching and public health reform efforts nationally, along with new federal funding. And how we use that in Washington State is up for grabs. Plus, the state legislature has appropriated significant funds for foundational public health services and promises to do more. So how that gets spent is also up for grabs. And then at a local level, in this participating in local boards of health, it's an opportunity to do more of what a lot of tribes have already been doing, and that is things that have been covered by mutual assistance agreements and emergency response efforts. There's a lot of shared interest and responsibilities with environmental health, with food safety and drinking water. Also, although it's not technically public health, a lot of local public health departments are very involved in environmental protection and restoration efforts. And so that becomes a forum for it. And finally, last but certainly not least, is communicable disease control. And we've been handed a sort of once in a century lesson in that with the pandemic, is how important this really is, how a serious communicable disease can impact virtually all levels of society and the economy and human relations, and, you know, how we define personal freedom. And the pandemic is, I think we've gone through another peak. We're heading into another lull, but it's not by no means over. You know, we will be dealing with this virus for the foreseeable future, but hopefully better, and hopefully in a way that's much less disruptive on our lives. That's the challenge that's ahead. So with that, I will stop this presentation and and just open to any questions or discussions.